Due to the COVID pandemic in the past year, aesthetics clinics were closed for most of 2020. But some clients couldn't wait for treatments, and so began to take risks. Anchal feeds were of botched jobs going viral. One client after treatment began to have necrosis, the death or decay of tissue, usually caused by insufficient blood supply, and it is irreversible. Her name is FAYE, and Anchal haven't ever met anyone that's had, like, a botched case. Anchal asked the lady that FAYE went to that actually did that to you, how did you know about her? FAYE said that she was qualified and also looked at her Instagram. The person she was doing Botox top was not available. She thought that she was going to be okay. FAYE believes that the UK does not have law and regulations in the aesthetic industry. That anyone can do a course then inject someone's face. Dr. Nyla will be examining FAYE to see whether she has any long-term facial damage, specifically around her eyes and the bridge of her nose. Nyla's clients have included Jess Wright, Fleur East and Mel B. Says that she will need to do a retinal scan and she does a visual field test. In Dr. Nyla's experience, every fortnight she treats a patient with complications that were caused by another clinic. Anchal wants to find out exactly what kind of training you need to have before you can start doing procedures. Anchal says almost all aesthetic training courses are unregulated, anyone can go on a training course and become qualified. In over 30 medical courses. She said some of her courses were done in one day and other few days depending on the training. Laura says she has spent over £40,000 on these courses, and this is how much a trained aesthetic practitioner is possible spending. Anchal research shows that Laura training included one of the few aesthetic qualifications regulated by the government department, OFQUAL. Laura says non-medics are amazing at what they do, but before going there, do your research. Boss Babes Uni is an international training academy based in Liverpool and Marbella. Experts say they receive a lot of complaints based on the quality and legitimacy of their training courses. This course was advertised on Facebook last year and it's called the Frontline Medic course. When Anchal spoke to OFQUAL, said they have nothing to do with this. That means you could have spent £5,000 on a qualification that does absolutely nothing for you. This same company started offering an online training course during lockdown which included microneedling. This is where small needles are injected into your skin to boost collagen and make you look younger. Anchal goes undercover to investigate the course herself. Anchal just the course. What stood out to her is no mention of hygiene, sterilizing equipment and needle stick injuries. How do you learn when you're reading a PowerPoint presentation and there was no demonstration? Before Anchal getting her certificate, she needs to practice on a face model, not a real person, but doctors have said it's a suitable alternative. Anchal said if this was a real person she could have caused them serious injuries. Dr. Wong argues that unregulated training is the root of the problem. Wong does not teach non-medics anything other than his complications course. He decided to teach non-medics the complications course because the law allows non-medics to actually practice aesthetic procedures and perform injections. Victoria had Botox for about 10 years and a friend of hers said she had an appointment available with a lady that I'd never been before. She just had the first lockdown. Victoria said alright, then everything was absolutely fine. Then she had the opportunity to have it done again, so she did. It was different. Firstly, it hurt, which has never happened before. Within a week she started to get these lumps appear on her face. Doctors are still investigating exactly what causes these lumps. Experts informed Anchal that Victoria was one of 9 patients botched by the same injector. The women who did had a 1-day's course to Botox 2154. Victoria trained at FAYE. Colleen Sayers Beauty and Aesthetics Training Academy. Anchal team went undercover on aesthetics. The patients you are seeing was offered a discount by Boss Babe Uni for students on this course. Vincent says what he saw was barbaric. This is not how you inject local anesthetics. Vincent says where the client's sitting, how it's aesthetics. The patients you are seeing was offered a discount by Boss Babe Uni for students on this course. Vincent says what he saw was barbaric. This is not how you inject local anesthetics. Vincent says where the client's sitting, how it's being performed, the hygiene, where it's being delivered, all of it is totally wrong. Vincent says the syringe and the needle should be a lot smaller to ensure comfort of the patient. This trainer was a nurse. In fact, she became a registered nurse. 18 days before teaching this course, Chris went on to say the needle was not introduced at the right depth and at the right level. Vincent will now say the patient should not be bleeding like that. ASHTON went on to say this girl is bleeding profusely. There's no attempt to clean that up. Chris says in the middle of the procedure, the person who's educating stops, touches all parts of things that are going to cross-contaminate that area, is inside the client's skin, which is a route to infection. Anchal went on to say she is smoking, or vaping, as well. Certified now based on that procedure, her clients will not do well because the teacher did not do it well. This is about making sure a medic or non-medic is doing it correctly. Undercover Botox courses say the doctor charged a prescription for £35 and he will allow you to get 4 clients out of that £35. The doctor does not come out to see you. ASHTON says that type of practice is completely illegal. This doctor should be struck off. Doctors are banned by the General Medical Council from prescribing Botox remotely. All consultations must be face-to-face. FAYE did not pass the undercover training. Like, share, comment, and subscribe.